My name's Peter Glick. I'm a PhD student here at the Open Lab at Newcastle University, and my research has sat down with nearly 50 participants who are citizens with complex healthcare needs or parents of those with complex healthcare needs. And we developed a website, a wiki, MyCareBudget.org, which helps them actually start off running their care budgets. So with a personalised care that you get from NHS England now, you get the money and you need to employ the carers. It's almost like running a care home in your own home, but with no support. And that's what that wiki does. It gives you that support.
So we got a personal health budget just over 4 years ago, and although it was agreed, we weren't given any of the infrastructure or support. I'd never been an employer before, and we needed to learn very quickly how we were going to employ a 24-hour-a-day team of carers, and we needed lots of documentation and infrastructure to support that, and we weren't given any. And it's just fantastic to have a resource like MyCareBudget designed and set up by people who've been through the process before us, to find all of the things they found useful so we can all learn from each other.
So there are a number of benefits to the research. For the participants themselves, they found it really helpful because they're very socially isolated, and this made them reach out to other people. They could see other people had the same problems. So the benefits for the research itself, I found that the whole area that I'm working in is almost like a vacuum, but I found that there's a huge amount of appetite for this, and people are really interested in the research because there's just nothing there on it at the moment.
In terms of MyCareBudget, it's been really helpful because it stops me having to invent a wheel. There's lots of resources available when you're managing a budget, which can be quite sizable, and managing teams of people. To be able to go to MyCareBudget and have a look for something that you need that someone else has already used. I think it's got a bit of added value in that you know behind it there's a group of people who've contributed, who are a peer group for parents in similar situations with young people who've got very complex needs. So that's why I found it and continue to find it useful.
So thinking about the long term with MyCareBudget.org, I think there's two sides. One is that it has to be sustainable once the research funding ends, and we've achieved that now. We've got a community interest company that will pick up and run the website once the funding finishes. But on the other side of it, if you've got a valuable resource like this, you need to put it in front of as many people as possible. So this video is part of that, but we're also writing research papers just to spread it into the research community and just develop the interest more and more.